So hello friends, welcome to my new video. So today's topic for discussion is hypertensive retinopathy. Okay, so there is lots of people who are having higher amount of blood pressure or having hypertension, but they are unaware of this thing and they are also unaware of the condition that it can lead to. Okay, so in this video we are going to understand about those things that higher amount of blood pressure can lead to. Okay, so hypertensive retinopathy is considered when there is a retinal vascular damage due to elevated blood pressure. Then we will call that condition as hypertensive retinopathy. Okay. So this is the range of blood pressure where the normal blood pressure is considered when the blood pressure is about 120 by 80 mm of Hg or less. If blood pressure is in between 120 to 129, that is the systolic, and diastolic is 80 or less, it is called as pre-hypertension. And hypertension stage 1 starts from 130 to more, stage 2 start from 140 or more, and hypertension crisis start when the blood pressure is more than 180 systolic, more than 120 diastolic. If you want, then you can take a picture. There is a screenshot of this so that it will be easy for you to memorize this thing properly. So this poorly controlled blood pressure affects several systems in our body like cardiovascular system, renal system, cerebrovascular system, and mostly retina. So retina is the only structure where we can see the blood vessels properly. So proper examination of fundus or retina gives us the idea or clue that the person is having hypertension so that we can control it properly, right? So there should be an active collaboration between ophthalmologist and physician to treat this hypertension. Okay. So hypertension of the eye causes three types of ocular damage: choroidopathy, retinopathy, and optic neuropathy. Now this hypertensive retinopathy occur when there is a damage in the retinal vascular vessel due to hypertension that I already told. Okay. So here the more duration of hypertension in the body, it will lead to more chance of developing hypertensive retinopathy. Okay. So this is the classification. So there is four phases of hypertensive retinopathy. Okay. First phase, vasoconstrictive phase. So in vasoconstrictive phase, vasospasm is there, where you will notice arterio narrowing and reduced arteriovenous ratio. So here the normal arteriovenous ratio is 2:3. Normally arteries are narrower than vein, but in hypertensive retinopathy, artery become more narrower and this ratio reduced and it become 1:3, something like that. So it will give you an indication that the person may have hypertensive retinopathy. Now if this hypertension continues, then it will lead to sclerotic phase where you will see AV crossing changes, copper wearing, silver wearing. So this continuous BP rise lead to some changes in the blood vessel wall. So here three parts of blood vessels are we know, like intima layer, media layer, and arteriolar wall, right? So here in hypertensive retinopathy, we observe thickening of the intima layer, hyperplasia of the media layer, and hyaline degeneration noted in the arteriolar wall. So this change lead to arteriolar narrowing with AV crossing change, and it ultimately lead to abnormal light reflex from arterial wall. So first of all, in the uh, mm, first stages it will show copper wearing, and in severe stages it will show silver wearing reflex. Okay, now after that, if this hypertension still persists, then it will lead to exudative phase where you will see flame shaped hemorrhage, dot shaped hemorrhage, and coronal spots. Okay, so why flame shaped hemorrhage? Because due to hypertension there is narrowing of the artery, which will lead to increase of the permeability, and arterial wall become narrow, weak, so it will lead to flame shaped hemorrhages. And also it will lead to hypoxic condition, ischemia condition, that will lead to swelling. Okay, so if this hypertension lead to more continuous, then it will lead to malignant hypertension where you will see papilledema, RP hyperplasia, and RP appear yellowish also. Okay, now let's discuss about the clinical feature of this hypertensive retinopathy. First of all, AV crossing changes. Here you triad we see in hypertensive retinopathy: Seller's sign, Gunn sign, Bonnet sign. Okay, in Seller's sign you will see deflection of retinal vein when it crosses the arteriole. In Gunn sign you will see tapering of the retinal vein on either side of AV crossing, and Bonnet, yes, banking of the retinal vein. Here the banking means tortoise like. Here this is the Sellas sign, where you will see that the deflection of this vein as this artery is depressing this vein. So there is deflection, means change in the pathway. Okay, and then if you see gun sign, then here tapering. Here you will see that the vein become tapered by this artery, so blood vessels cannot move or flow through that vein. Okay, and bonnet sign means here you will see this type of tortoise wavy pattern blood vessels. Okay, now this is the arterial change. Here you can see that reduction of arteriovenous ratio, and you can see these veins are more in thickness than artery, and it become narrow, right? And it is appearing like a copper wire, right? So this is how arteriolar changes is there, right? Retinal changes. So, what are those retinal changes that you will see? First of all, you will observe dot and blot shape hemorrhages and flame shape hemorrhage. These are retinal hemorrhage. But in retinal changes, you can see two things: retinal hemorrhage and retinal exudate. So here you can see flame shape hemorrhages are there, right? These are dot shape hemorrhages also present. And in retinal exudate, you can see these are the cotonool spots and these are the hard exudate. So hard exudate are the lipid deposition in retina, and cotonool spots, they are due to ischemia of the nerve fiber, right? So this is why cotonool spots are seen. Now if you see the macula, then macula is appear as star shape like this. Why? Because of the deposition of hard exudate around the macula, so it give you an appearance of star shape. And optic disc changes, here you can see optic disc swelling. Okay, so here also you can see this optic disc swelling is there. So that is in the last stage, right? So this is the classification of hypertensive retinopathy, where we follow Kate Wagner and Barker classification, where stage 1 here slight constriction of the retinal arterioles, stage 2 here stage 1 symptoms are present, right, like constriction of the retinal artery, and adding with that focal narrowing of the retinal artery and AV nicking is present. AV nicking means AV crossing are more prominent and artery become more narrower. Okay, and in stage 3, stage 2 signs are present, along with there will be flame shape hemorrhage, hard exudates. And in stage 3, this is present. Stage 4, stage 3 signs are present, along with optic disc swelling is also present. Okay, that is the stage 4 in hypertensive retinopathy. So what is the management? Sometime if there is more swelling of retina due to this hypertensive retinopathy, then Avastin injection is given, and the main thing is that to control the blood pressure. The patient have to control the blood pressure, otherwise hypertensive retinopathy cannot resolve. In many cases it is seen that the vision recovered, right? Many times this hypertensive retinopathy is asymptomatic, painless, so the patient initially do not feel any visual disturbance until this condition leads to more severe stages. So well checkup of eyes as well as blood pressure time to time is very important to rule out these things properly, right? Now, these are the differential diagnosis of hypertensive retinopathy. First of all, diabetic retinopathy, CRVO, optic neuropathy. In diabetic retinopathy, it sometimes resembles hypertensive retinopathy, but here papilloedema is not present. And in diabetic retinopathy, flame shape hemorrhage is also not present, dot shape hemorrhage is present. So these are the some things that by looking at those things, we can actually differentiate a diabetic case and hypertensive case. And most important is how you are taking history from the patient. So history tells you everything that the person is having diabetes or hypertensive. Okay, and CRVO means central retinal vein occlusion. Here also you will observe flame shape hemorrhages, but you will not observe those cotonool spots, all those things, and papilloedema. No, you will not observe those things. Optic neuropathy, disc edema is there. It is known as papilloedema, but you will not observe those flame shape hemorrhages, right? The star shaped macula. No, you will not observe those things. So these are some signs that will tell you that this is not hypertensive retinopathy. This is other things, right? So that's all, friends. Thanks for watching. Please don't forget to like my video and subscribe to my channel. I hope this video helped you to understand something more about hypertensive retinopathy, and please do support this channel.